Hello everyone. I hope you all are doing good. Uh, Today we will be discussing health policy and its analysis. As we discussed in our previous classes that we will be discussing managing and we will be categorizing different policies by looking into different policy levels and analysis of different policy by different governmental sectors, controlled or formulated or given by uh, personnels, policymakers, and different governmental officials who are responsible to formulate a policy. In this regard, as we discussed in our class, I am today is covering health policy. I'm trying to elaborate health policy, its issues, its formulation, and its analysis. That how we are going to analyze health policy. You can take this as a model. You can take this as a uh, case study. That how we are going to analyze, how we can make an analysis of any policy, any given policy. Like uh, in this setting, in this session, we will be elaborating, we will be analyzing health policy. So as you all know that health is the primary issue, health is the primary need of human beings. Health is the core of every government in the government that uh, not any prime minister, president, or any governmental official can ignore the health in his or her country, because health is directly related to the people of that country or nation state. Without health measures, without appropriate health facilities, there are there is a huge criticism on a government which neglect the health issues. For instance, when in previous uh, tenure of American President Barack Obama, when he initiated health policy plan and he started to give people benefits regarding the health issues, that government was appreciated, that bill was appreciated, because health is the primary source, health is the primary matter in a country settings. Health can make or disrupt the public mood, the trends in the government, inside the government and outside the government. So we cannot, you can say, ignore health. We cannot ignore the well-being of people. It is very important that we stick to the policy agendas. The government should stick to its policy agendas and make health its priority. So in this regard, today I am presenting you this session to give you a proper look in health policy issues and analysis. So in this regard, first of all, we need to define what is health policy means. How can we describe, how can we determine, how can we define the matrix under which we categorize health policy? So the first definition which I gathered is a set of decisions or commitments to pursue course of action aimed at achieving defined goals for improving health, which means that there are some set of decisions that we are bound, we are abide by those decisions by the government or the commitments by the government. But commitments or decisions for what? Because to pursue the course of action. And what will be the goal of that course of action? The goal will be improving health of the people of a state or a nation state. Secondly, policies usually state or infer the values that underpin the policy position. This point is about policy positioning, the policy, the prioritization of policy. That how a government is prioritizing its policy, how the values of that government underpin the policy position, where the health policy stands, where the health comes in the policy agendas of a government. Third, they may also specify the source of funding that can be applied to action. So I'm going to take a pause here, and I'm going to elaborate the importance of the specification of the source of funding. Why it is important that a government is looking for the source of funding? Because when we discuss planning, when I give you the model of planning, when I described planning in your class, the first important point, the major important point was, for the planning we need resources, we need wealth, we need capital to invest in our plans for our policies. So the government or an agency or a particular person even is making a policy for anything else, let's say for health, let's say for uh, accountability. For that, for the fulfillment of that policy, we require funding. The source of funding should be applicable. The source of funding should be specified. And when we connect the other part, the planning and management arrangements to be adopted for implementation of the policy. Now, the second portion is this. I'm going to mark you that you may note that what we are talking about here. The planning and management arrangements to be adopted for implementation. Now the implementation is important. Now here the key word is implementation, which means that we covered the stage. We have undertaken the step of fundraising. We acquired funds. The funds are dispensed on our proposal and on our disposal, sorry, and now our policy or the planning initiates in the implementation phase, and the relevant institution to be involved. Now when we have funds, we will start implementation of that policy, and when we implement a policy, we need institutions, relevant institutions. For instance, today we are discussing health policy, so it means that the relevant institution is the health personnels, the health care providers, hospitals, Ministry of Health, health ministers, bureaucrats. So this means that the policy undergoes from phase to phase, from one point to another point. First of all, we as we discussed, funding is important, then management arrangement and implementation and in the last relevant institution. Moving forward, aim of health policies. Every policy in a country, every set of policies which we follow have aims, has different aims when we talk about policies, when we make a category of different policies. So I dissected those aims. I tried to define for you and try to make it simpler for you, for your understanding. So the prime aim, the very foremost aim, the most important aim, the central aim is maintenance and improvement of the health status of populations. Not population, but populations, without any discrimination, without gender parity, without any class, creed, or any difference, which include populations, not a singular population, but different populations. So the prime aim of health policy is to maintain and improve the health status in a country. It is very important for the policy makers, for the policy givers, that the status of health of population will be maintained on a optimum level. The balance between health and the other policies in a country is very important. The second point is, the second aim is that the risk factor which influence health differ between countries. From country A, you have country A, we have different set of health factors, risk factors. As we move from one point on a globe to another, from one country to another, the risk factor varies regarding health issues. In some countries, there are different diseases. For instance, in Pakistan, we are fighting with polio. We are trying to eradicate polio. But in the Western countries, on the contrary, the polio has been eradicated a decade ago. So it means that we have different risk factor for different countries. We have different, different set of problems which every country has to face when it comes to the health policies. So the aim is to address those risk factors. The aim is to address that difference from one country to another country. We cannot make a generalized policy and we cannot implement it on every country in the world. Thus, the policy for health will be influenced by different factors in each country and region. Because of the risk factors, we will indicate different factors of that difference. That how difference emerged, that how difference can be addressed. So in this regard, this will be the aim of health policies, to measure the different factors, to indicate different factors which is different from each other, which is different from one point in one country with the other point in the other country. Addressing the issue maintenance and improvement of health status of population is the aim of health policies. Moving forward, So there are essential concepts. We will be discussing essential concepts regarding health policy. Very important concepts regarding health policies. We should know these concepts while understanding, while developing a policy, as we discussed in every class, that we should know the basic concepts, the basic conceptualizations regarding any issue. So here we have four different concepts. Health status. I will get back to their explanation when once I done with this slide. Second number is health services, but these are self-explanatory terms, but we will discuss them in later slides. Third is organization and financing, health commissioning, which means we need to uh, develop a wide administration, a very vigilant, wild administration for financing. Number fourth is role of public health, assurance of appropriateness, criteria, access and utilization, CAU. So criteria, we need to define different criteria. We need to access with different on different resources, and we know the utilization of those resources. So when we know these concepts, we can formulate or we can analyze health policy. Moving towards the explanation. So, what do we mean about when we say health status? Which means that in a very raw form, in a very easy and simpler way, uh, if someone say the health status is good, health status is bad, we uh, we we have a very important and we have a very clear image in our mind that what we are talking about. We are talking about what type of health services we have, what type of diseases we have, what type of uh, counter actions to cope with those health issues. So increase in non-communicable diseases in the developing world together with the abatement of the mortality from infectious diseases. It means that the health status is changing. Health status is in a constant array that from one point the increase in non-communicable diseases. The very recent crisis from which the world is going through is COVID-19. The issues which we are addressing nowadays, the health status is or has been challenged because the mortality from infectious diseases varies from one point to another. Secondly, in developed world, the problems are mainly concerned with the elderly rather than children because of the immune system. As we all understood by now, as this novel corona COVID-19 has taught us that the immunity is important, that without strong immune system, it is very likely to catch that disease, catch the pandemic. So the in developed world, What is the problem for developed world? They are good, they have good living standards, they have good policies, they have good health care. But what are the concerns? If we take the example of COVID-19, that what are their issues? Why they are facing so many issues? Because the problem in the developed world is elderly, the people with age, the aged people, rather than the children, because in children have a very strong immune system in them. So we can apply this concept, we can apply this in this current scenario, in this current status of health. And this has important implications for health policies. Here I am trying to establish a fact that from one point in a world, in a country, the issue of diseases, the issue of the categorization of diseases are different from the other part of the world. And this difference is the health status. And this health status has important implication. So let me draw an arrow for you so that you may understand this, that health status has important implication. Health status means that what country is vulnerable to which disease. Moving forward, the health service problems faced, the people who are making policies, the people who are establishing different policies and trying to make policies in regard to the betterment of people, what are the problems they faced? Inequality between different geographic areas and social groups, that there are different geographic areas and social groups which cannot be treated as uh, the treatment of the other part of the world because of the geographical constraints, because of the social and cultural constraints. Different people have different mindset to the treatment. Different people have different customs, different taboos for the health. Let me give you an example from this, that in recent years, the increase in the mental health issues, or increase in the depression or anxiety, people started to come forward. They started to talk about it. But before that, but before this issue, before this crisis, people, this psychological issues are considered as a taboo. They were shy. They thought that we should not talk about it. We will be categorized as mad people. So variation in the utilization of services for similar conditions. So it is very difficult to operate in various situations, because with the situation, with the passage, with the outcomes, the areas, the geography, the social groups, the social structure, the ideology is different. So the difficulties in the appointment of limited resources. When we talk on a massive scale, when we talk about uh, different scenarios in different under different crises, we talk about we talk a huge scale. We talk for the entire globe or entire world. When it comes to that huge or massive massive uh, need of health care or health services, the resources become scarce. The resources become limited. The lifestyle, behavior, and political economic situation and the health services have an essential role in improving quality of life. The quality will be improved if the socio-economic status in a society will be you can say increase or improved. So that gives the valuable improvements in other aspects of health status. So organization and financing. This is one another important and interesting, you can say, slide. The state is involved in all health system in varying degrees. By now you can understand that by discussing different matters, by discussing different scenarios, we understood that state is the main entity here. The state hold the cards here. The state is involved in all health systems in varying degrees as legal regulator of the arrangement for patients to receive medical care and doctors to receive remuneration. Remuneration means their pay, their capital. So legal regulator of arrangement for patients, that patients should be regularized monetarily as a contributor. The first point was as a legal regulator in which the government body is involved, in which the government relations with doctors or the healthcare providers is established, is made. Third point is as a contributor to healthcare financing, like an NGO, like an institution, or like social insurance, that who are responsible for giving people necessary health services. As a contributor to healthcare finances, taxes or compulsory social insurances are assured by the contributors to healthcare financing, or as a guardian to ensure that correct balance of resources is used to achieve optimum population healthcare. Healthcare may be conceived in an economic framework as an exchange of goods, that if we are lacking in different medical supplies or health care supplies, we can exchange it. We can take part in different trade situations. We can create an atmosphere in which we will discuss economic framework, and we will talk about these issues in that framework, in that economic framework. So patients seeking medical care are making demands while doctors are supplying services. In this scenario, in this issue, when pandemic hits, the entire globe, we are seeking medical care or making demands by asking for doctors, by asking for the different medical specialists to come and tackle or uh, address the situation by supplying their services. And for that, we need finances, we need organizational support, we need organizational institutions and organizational administrations. So I think we covered that organizational issue and financing of that issue. We discussed that a state is the originator of that power. And we discussed different scenarios in which we discussed legal regulator as a contributor to healthcare finances and as a guardian to ensure that the correct balance of resources. Then health commissioning administration. That what we understood when we talked health commissioning or administration. Health commissioning needs to take into account the following factors. Number one, improvement in health. Number two, risk reduction. Number three, services and protection. And number four, data needs for monitoring and achievement of the task identified. So these 4 points, these four interesting thumbnails are health commissioning, administration, that we need to commission these 4 steps. We need to make sure that every person in the community or every person in the locality have access to these 4 issues, for these 4 facilities. In current situation, let's suppose we have an issue, we have an patient, or we are dealing with a survivor, or we are dealing with a person who needs medical attention. So what will we do? We will improvement the in health status by giving those populations, by providing those population with medical help. If they are infected, if they need medical attention, they will be tended to. Number third is, how can we administer them? We can administer the risk reduction, that when we started, we will establish a comparative analysis from when we started, and with the passage of time, how we reduced the risk, how we made the risk reduced, what step we have taken to address the issue, and then reduce the risk amount or the risk uh, surfaced for the people. Then services and protection. This is very important for healthcare providers or the health policy makers or the issues or the people who are dealing with the crisis, is that we need to define different services to protect different classes, different vulnerable classes in the society. We tend to ignore children, we tend to ignore the women status, we tend to ignore the disabled, and we tend to ignore these minorities like the gender unspecified. These are the common practices when a crisis emerged. In COVID-19 situation, we also saw this as well. But health commissioning, it is the responsibility for the health commissioning that services should be provided for everyone, for children, for women, for elderly, for disabled, and for gender unspecified. It is the responsibility of a healthcare provider, it is the responsibility of the person, the focal person monitoring or operating in certain area to ensure this. If a person, if a children, if a woman is abused or if a child is abused, that services should protect those people during the crisis. This is the responsibility of health commissioning institute. We should address those uh, victims of the situation. Number fourth is data needs for monitoring the achievement of the tasks identified. It is important and it is necessary for the health commissioning that data will be monitored. Data is monitored with the passage of time, with the passage with to know the effects of their campaign, the effects of their uh, efforts. This is how we take into account our own progress. For instance, uh, like polio, when we started, we have many cases of polio in Pakistan. But with the passage of time, although we are not polio free, but the reduction in cases and the reduction in risk is increasing. And we monitored that data from point to point, from making different gateways and checkpoints by United Nations and by United Health Organization, World Health Organization, and UNICEF. They collaborated with each other and they monitored. They made different gateways. From there, they checked the increase or decrease in the polio cases. Same is the scenario when we discuss this COVID situation. How we are dealing with it, how we are giving services to the person, to the people, to the women, to the children who are subject to abuse with the situation. There, they can be abused, they can be forced, coerced. So when they came to healthcare personnel that should listen to those people, that should monitor those persons, and with regard, this comes with the job description of a person to render his or her services for them as well.